A push for single-payer health care in our state has many people asking, just what is it? And would it change when I go to the doctor's office?
As Karina Capabianca tells us, it's a controversial proposal that would fundamentally change the way New Yorkers pay for their care.
If passed, Assemblymember Richard Gottfried says the New York Health Act would essentially become the main payer for health care in the state.
You would go to your ordinary doctors and hospitals and physical therapists and whatnot. The New York Health Act would pay the bill.
As for the payment of the plan, it would be through tax. There would be no co-pays, deductibles, or premiums.
The tax would be paid in two forms. Payroll, earned income would be taxed through a payroll tax that would be paid at least 4/5 by your employer, up to 1/5 by you as the worker.
He says under the plan, the private sale of insurance would only be allowed to cover things the law would not.
Frankly, I can't imagine what an insurance company would want to cover that the New York Health Act would not cover, because it's more comprehensive than anything in the market today.
But opponents say that would result in job loss.
Both on the provider side and the insurer side. And I think there could be a ripple effect right into our economy.
Dayhill says the state and federal government currently pay hospitals at rates below their costs.
There's every reason to expect that if this bill was to pass, the rate that would get established for reimbursement would be pegged either at the Medicaid or Medicare rates.
Nearly $140 billion would be needed in new state revenue to pay for a single-payer system in New York in 2022, according to a RAND Corporation study. At the state capitol, Karina Capabianca.
And for the health stories that matter to you and your family, head to localsyr.com. Click on the Community tab to find health news.